hey when I can program he Trinity Hospital program remote anilova Association of Surgeons of Mizoram kantia Mizoram surgical specialist ho surgeon ho in inkawm to me association to me then continuing medical education kanti mai it is doctor te insir social na program pakhata kan duan tel ane ke ni kan tel vea chu ta chon atilhotling tu tur chu atilhotling tu tur a bera chuanin kan mi khwal poi mo hei Dr. Chandola Delhi tanga local hi ni lung zaya hianin kan training lai khan Chandigarh kan MS kan training lai khan lung zaina hian ni ang department ang Cardiothoracic surgery ate kami department akan sathum lai kaum beni khang lai ne chon tu chen chawhlui tu ni tu nai chon engkem hian ne ya tin tu na hian kan van nei na em chu hei ani hi Dr. Chandola hi Varanasi Benaras Hindu University attending MBBS Pasa to Nuga Kanpura MBBS le MS so Varanasi so Kanpura MCH ami lunglam zai specialty here zirle postdoctoral course so mizo public is super specialty antimaya kan travel bak lo ke ni super specialty te himo specialty kan timaya ke ni chu so le chu mi nuwa India ramun ra zaya Delhi velate chuan khovel hun rang zirna dang lung zai lung transplant lung thalo lung midang lung tanga lung danga thak te kadeng kha azir abi tak in Germany le Canada te tuna po hian fellowship hi membership ni nei anga em ni chuan Delhi khuan National Institute of Heart Lung Diseases Research Center te hi adina ama hi auto power nei tu ani tani auto power ti chu founder president ania ta chuan a team hian thoka chuan an team hian local Trinity hian Mizoram lo ten ron zai tani chuan in khethawa nang ni so ke ai pe ni threzo ka an ron zaya an zai nu khan in that ma chu an team mi kha tul kha anom an chama in that nu ho tha chon khateng khan tuna hian mi na khu ti la an zu pan thak kha he tan lo ka ta he kan lok na ni tin Mizoram a pe khatna ni wang hian helaya doctor te po hian kan la mu ngai lo thil ve ka ni tin thetiang han ti tur hian equipment hi kan nei lo hian ron keng thina an mani ta a lo nei ve ngot po ni la kan mang thiam chung lo ma an ni chon an man reng khani bang kan an ron kenga ta an ron manga an mamot man zo han ho thai ma ya khateng kha miroti sakani chuta chuan hei mi tam tel tel tu na po hian hetiang ani changlo hian kan cardiologist dang te po hian lung specialist dang te po hian hemi Kolkata le Delhi velan zupan velor velatan zupana heta thisen zam atanga lung chunga thisen zam block an vati that dan an vati that anga hi zachuang an ti do ni to hian Trinity ason chu voina te hei car an local renga to hian nglai pen kan nei ti the ani chu de bera chuan tu na hian nang ni ho zaina ang chi ani ho kan ti le ta ka hi khami ba kan ma son le na ni ta nei then kan result hi ke ka ngai chu kan zir la Chandigarh vela te kan zir la kan result te ka ngai to chan tu chan tha ta ka nei zai ma le zai no in thlau tak chuan kha ania tu na hen nang mani hi an zot diet to chen ka ria ngai har sana in nei te eng te ngai in nei tu na hen han soi tu inomen tin khata khan han zo chian du teo man
ole kan ngai thang khan chen chu keng yo chu zai kha kan ni bik ta chen chu ka u po hi valve wa sak te kha anita a chuan lam hi an nei teu ve fowa mara zo azia ve le a ti chuan pathian zara ke chu ngai ni bypass in tiang chi kha kanita chuan lam kan nei lem hran lawa apon an na thiam thuam deuh te hi chu a oma tu lai khaw lai phei chon a om thina chung valve thak te nen chuan ngai ni pathian thu ti tel tiang ani rolling kan tan hian a risky ngai ni om ani ai hian kan hlau thon om bi kem kan thabik zo kem stand vo katina ni chu stand vo le hemi bypass ho te hi nge kan dangalam na ti lai kha karil ro ka ngai to fo ane in hon ta ka jang khazo ta ni chu
bypass hi stand vo thelo ho bypass hi chu stand vo ringo ta a thelo wang bypass anga yang ti chi hi no ni ani hi zot taila soita se intrithiam chongin karing lowa chu a block an sa mai he chu stand vo chi po de lo bypass ang.
So the question is difference between stent and bypass, right?
Yes.
Okay. So see, stent is done for patients with single vessel disease, where is a blockage in the artery, either in the single vessel, or sometimes if the lesions are very short lesions, discrete lesions, their stenting is done. But now there is enough experience and enough evidence in the literature, and what we have seen the experience also, patients with double vessel disease or triple vessel disease, especially the patients who are diabetics, they should always have bypass, because the bypass has got excellent long-term outcomes. Stents can block, in 6 months, a year, 2 years, 3 years, who knows, right? But then the bypass grafts, they last for a very, very long time. That's the difference between stent and bypass.
Stent le bypass kan ti khachuan stent khachu single vessel disease kan ti ta chu in lung chunga in vein kha mun khata te lo no amo engting kan sayang a no tu kha alo sevak lawa alo te deuh khan khata khan stent kha kan anwa theita ni amaro chu in lung chunga khanin a veina khanin disease anat na khami a no tu kha mun thuma te lo om khan stent wa kha boy thak ta ni chu kha voi khat stent kan wa khanin mun khat lai an siam that khan thathum nga a thathum zo nuwa mun khat lai kha siam that le ngai thin ta kha huna du rei bok ta khang zong ai khan voi le khata khan bypass ha chuanin voi le khata khanin avai khan a mun thuma mi kha an siam thangai vek theini chuanin stent kan wa chuanin tharuk nuwa te tharian nuwa te block na chance kha omle ta ni kha zong kha bypass a chuanin block na chance kha atlema kha dam lo tan chuanin a benefits zo a thazo ka ni chu ani na ta ka chuan voi khata khanin in lung chunga in ven kha mun thuma alo block ta kha voi le khata khan bypass a chuan asiam thangal vek the stent a chuan ni voi le khata an siam theilo thathum zel nga ngai pakhatan siam tha thathum nga ngai a wa pakhatan siam le a kha kumdo na de thin
chuan ni che ai soizok valve thak de kha valve thak kha chu a major kha me lung kha ko na ngai ma lung kha an honga chunga valve khan thak ta ni hei kapi hi valve panilan thak ni ai nang lo nang ni chu ni lo valve bypass na nang ni chu lung supply to tisen jam kha ablok ni kha khan siam thmai ni ablok na le lama khan tisen jam dang khan som ta ni kapi te hi chu a lung sunga apam ti apam thena tura aval ba ka chia kha valve ngai ni valve company siamin an thak ni mi singa valve om lo khan khan valve pakhat changpo ni lo valve patni ka voi ka ta thak ngai ta chu double valve replacement an tia ka tiang khani an mani po he nat pon nabi ka mo an he an thot hei mang lo an lo ka mani sai ma be ka jon ni chu sai ngam do na mi ka tia zai he thata me ma kha lung zai he chi rang rang khau ta mo
cái này ông tan khan bypass ông khan ông hậu tan khan cái khá hát được các bạn các tiếng sẽ chua các cái điều mà ya chuan hi hát được khi anh lâu zel em chỉ lệ tin anh entirna tu là hiện cái mà bây giờ chúng các cụt phá lệ các cái phá các sợi cái này chỉ là bộ các mi trang lệ lâu nghe các lâu đầm tối à chỉ thiên điểm chỉ các mỗi tiền cần dọn về lại lúc anh ấy.
So one good thing about the bypass operation is anybody who has got bypass operation, rest assured that you will not have any heart attack. You know, the chances of having heart attack are only 1%, 0 to 1%. That's it. 99% of the chance for the rest of your life you will never have any heart attack. So your heart is totally safe. You know, that's the beauty about bypass. You know, it gives long-term survival. At the same time, symptom-free survival. And the third thing is freedom from any heart attack in the future. You know, and good pumping action of the heart. You know, these are the advantages of the bypass operation.
In short time nga bypass tito khachuanin heart attack nei na chance kha atlem to lu tuka kha wang khanin in lung kha a risel to a thato ni chumo a har satna thei to lo ting chu
short distances to motor te scooty te khalta ni hladeu hlek hanjin pui kha a hlo omem te kha kan zot lok ani chu.
So he is almost more than a year after surgery, right?
Yes, sir.
So now he can drive to any distance he wants, you know. He has to stop thinking about his heart. His heart is safe, you know. So don't worry about any driving or any exercise. He can do any kind of exercise. Yeah.
During my operation, I was told that you've done some ballooning. I was curious about that.
Yeah, sure. So, like in David's case, you know, his heart function, he had a heart attack, his heart function was low, very low. And in such patients, and his, you know, when you do the operation, you know, in patients with recent heart attack and low heart function, to support the heart, you know, you need a balloon, you know, it's a balloon that you put through the artery here, and it goes outside the heart, and it just inflates and deflates, just like a balloon. And what it does is, it increases the blood flow to the heart, and also it increases the blood pressure, you know. So when the surgeons operate on the heart, there is no drop in the blood pressure, you know, and surgery becomes much easier and safe. So the function of this balloon pump is to support the heart when the operation is done. And then in next 24 or 48 hours, you know, after the operation, this balloon is taken out, you know. And this balloon really has helped us do, you know, very sick patients, you know, patients like you, patients like, you know, we've done so many patients with low ejection fraction, you know, whose heart function is 25%, 30%, you know. So that's, in these patients, if you put the balloon pump, especially when their blood pressure is down in the operation theatre, you know, at that time, the heart, there's a great support, it provides support, this balloon pump. And then it can be taken, it's very safe, and it can be taken out after 24-48 hours. Yeah.
In lung kha in zeima kan check chin khamo ikoma kan check china khanin ta khanin in lung chak zong te khatyang za te kha kan lo entrin ta kha in lung kha a chak lo lutuka a thisen pek chwa tur zat kha ani tur ang kha ani phalo chin ta ni khati chung chunga operation ti kha a hlo om ta kha wang khanin operation ti lai khanin ballooning an ti chu in lung a hetia zuk phul dai kha siam tu tur na hetia a phut kha a that chuan in bp te thanga drop te om don lo ni chu kha wang khan operation in ti lai khanin in bp te kha a drop lo na turin khami balloon khanin a lo puyanga operation ti po a ol sampha anga chuan khami balloon kha operation ti zo a po khan kha na la puyang cheunga ka chuan 24 to 48 hours vel kha in bp a stable nang mani in stable no a khanin ol sam takin an la chuak lenga chuan nang mani kha in lo stable vek tong operation ti laya bp drop thut ti te har san na om turang kha khanin aveng don ani chu khami khol khan
open heart surgery hian entirna valve thak lo ta khami valve thak kha a chele them a chiani chuan a thak thengem tin chu lawa chuan engtiang anga kan indim tur nge ni ang hemi open heart surgery valve thak ho hi ti kha kan zot.
So I would just tell brief about what operation she had. You would imagine what kind of. So her she had. There are 4 valves in the heart. In any human heart there are 4 valves. Her 3 valves were damaged. So one is called mitral valve. There was a severe leakage and blockage in that valve. There is another valve which was again very tight and it was very narrow, and there was a third valve which was very leaky. So her 3 valves were dysfunctional. They were not working at all, not working good. And on top of it, she had low heart function also. Her heart function was 35 to 40%. We call that as almost severe heart dysfunction. So it was very challenging operation. If you see, even in the best of the centers, like if you talk about centers in Delhi, so if there are 15 heart centers in Delhi who are doing these operations, probably 11, 12 of them will not take her up, will not do her surgery. They'll say, no, we don't want to do the surgery, right? So that's the risk involved there. But because she was quite short of breath, she had some problem and she got admitted in the hospital before the operation some time ago, and then we started medication. You remember she was in CHF, admitted with CHF, and then diuretics and all those treatment was started. So in such a situation, these valves will not, bad valves will not let you live, that they will just, patient doesn't survive long. So, but then such a challenging operation was possible here in Aizawl, This is something really phenomenal, and this speaks volumes about the hospital and the services infrastructure which is available here. So we did change 2 of the valves. All 3 valves were changed. 2 valves were changed and 1 valve was repaired. There is a special technique to repair one of the valves, right? So all 3 valves had operation done, and she's doing phenomenal now, and her question was, how to take care of the valve. It's very simple. These are the valves which will last for a lifetime. She got metallic valves. This will last for a lifetime. She will not have much problem there. Only thing she need to do is one medicine, which will it is called blood thinner. You just have to take that medicine to keep your blood thin, so that there is no clot formation anywhere in the heart. That's the only medicine. One medicine in the night time. That's all she needs to take. Other than that, normal lifestyle. That's what.
PK sa ka chuan in valve kha ni ta valve tam tak nang mani point ron kal treu ta a question b ka khachuanin engtin nge kanin en ko lang ti khania api khachu api ang valve reng nang mani ang po valve shim khachu poimo ber chu thisen test tur kan ti huna uluk te walo test chumi zo a chuan thisen test mang khanin indam doi ei tur kha kan siam rem charang indam doi kha in lo ei tamlu tuk thiang lawa in lo ei tlem thiang lo ke mani shat puina thap khanin indam doi kha adjustment kan ti charang kha lifelong a yanga ya chuti ral chanin thisen test kha test huna khan pangai tak khanin lo test char kha cha kha poimo berta ni chu chanin api valve kha machine chanin valve pali kan nei ta kan lung chamber pali omta api bi ga kha chanin pathum achia a khami pathum achia tela siam thatangai ta hospital dang phai apo kal se hospital tamzo khachuan an lo ti du lo tur angkha hospital heta mizoram nge ya ti theina kan doorstep kan in bulma ya ti theina alo om to kha wang khanin lung zeite wa thalaute kha zongjong kha India ram mun shan pan ngai lo khanin thatak in heta han a perform ve theito ati ve theito tin
awa khamo pi awa kha ache thelo idom chu ngade engma ti ngai lo ate ni chu izo na ber kha chu ba ga chuan apoi mo ber chu thisen khang na dal tu tura dang lo pet chela zan mu do nei tu kha kha ei reng tu ran aba su thil ti turong lo tin lo tu reng mo lo te oxygen thisen ka oxygen pe a pam bo kholi chu ti chung chuan lung le cho bi thok kha om lo ra ani ta zala re soi de khan an thi ni khol kha na maintain ka kan du khan an restart le ani na da chuan Dr. Chandola hi chuanin adulan ti thilok adulan ti lung le kha ti vel khan enga ma ngai la ini ekai kan ti tu ra khan enga ma ngai chuan zona dangam to lo chuan
stand vo ho kha min ko ve lo wa an tam to wa
stand bo ho hi atia ni lo mo cardiologist dang ti ne he jum medical specialist kan ti ang ho cardiologist hoina an lo an ti thei chin hei endos tanglovin chu mo tangin catheterization an ti ati ang ma ti khani wang khan ati ve ngai lo ani chan ati ve thau thin mai thai ma se tan chana ne bang
ole zaina hian helai buna Trinity Hospital le engeni kha tangrol pol kha ka he to lawa surgeon ho tena buatsaih hetiang keini lungzai ho min han ko khom hi hundanga kan riat ngai lo ania tin Mizorama hian lungzai so Trinity Hospital chap te hen ni hrim hrima tive a ti tur point hetiang ko khom ti tur point anom chuang lova hetiang anga nan ti le zel hi lomom kan ti tlang khop mai ning ka ria tin khang ba ka ke ma ni ina kan lo lo thon ve ruk thin nun na toy ta riau tur anga in ngai na te lungzai kan ni chon engamo hleka mi pui po in kan sung te po in lau thon om ria wa min ngai na te an neya ma se khang kha kan riat le kan lo lau thon na ang zong zong po doctorin ama ka nge ya min han changa min han thamuan kha alom om kan ti em athil dang soi tur dam tak chu a omanga hetiang min han buat sai hi alom om ema min zai tu doctor nge in kan zo na te chiang ta min han chan saka chu po kan lung oi kan ngai that na tu ratana min chang kha abik takin kaloma ka chen te po an lomang ti karinga khang kha kan soi ni kalome
to the son Dr. Chandola will invite our surgeon Dr. Rahul Chandola to deliver a short speech as whatever he wants to say, then that will conclude our meeting, our brief meeting.
Devo, can you translate for me? I wish I knew Mizo language. So, first of all, I would like to thank all of you, our lovely patients, who have spared their time to come to Aizawl Club, and spend some time with us. Thank you so much for coming.
In the way in Hulu taxinga, hit live on Kaligan Long Taxita.
That's all. I spoke so long and you just, just 3 words. That was the main part of the speech and she just shortened it. Okay. So then, we all are thankful to you, and the thing is that in the state of Mizoram, we feel proud that we are able to start the cardiothoracic program, the cardiac surgical program. So any cardiac surgical program is a mark of the strength and available infrastructure and the facilities in any hospital. There are not a lot of cardiothoracic centers across the country. We are very proud that we are able to start a cardiothoracic program here in Mizoram. The patients who were going to far off places to get heart operations done, now heart surgery can be offered in Mizoram. In last 1 year, 1.5 years, we have been able to develop this very well meaning program here, and now we hope that with this, the kind of patients that we have done. Acha, you can translate, or maybe now. The kind of patients that we have done, we all know that they are all high risk operations. Some of the patients, they had heart function of around 25%, 30%. And some of the patients had multiple valvular problems, So multiple valvular operations are very difficult to do, And some of the patients had chronic kidney disease associated, diabetics, like he had, a recent heart attack. He had involvement of these carotid arteries, the blood vessels supplying the brain, they were blocked. And he had kidney disease also. His creatinine was very high, 3.5, and his vessels were very bad vessels, very calcified vessels. Heart function was 25-30%, right? So imagine a patient who has got recent heart attack, heart function of 25%, associated chronic kidney disease, kidney failure also, and then blockage in the arteries of the brain, right? And we did bypass operation in him along with carotid endarterectomy. We opened up this vessel also, and at the same time we ensured that the heart's pumping improved with that. And now he's almost, how many months? When was he operated? I think almost 6 months now. So almost. So almost 4 or 5 months now. And such a patient with chronic kidney disease, blocked arteries of the brain, with uncontrolled diabetes, poor heart function, and he has got such a good operation. He's doing so good, that. So this is something. These operations are not even done in Delhi. Some of the centers, very few centers in Delhi would take up such cases. We are proud that we are able to provide all that, those kind of surgeries here in the state of Mizoram, and we're really thankful to the trust that the people of Mizoram have entrusted in us, and we will continue to deliver our best, and we'll keep serving the best we can to the people of Mizoram.
India ram mun shanga te lung zaina mun shana toa tutiang ang bok cha Mizoram ate hetiang ang ti thei tura hospitalina facilities kan lo nei te alomama an mani po tutiang perform thei tura ron kal thei shim hi an mani po an loma chanin ke ni Mizoram chung om te po kan loma chuanin abik takin mundanga chuan India ram mundanga chuanin operation lung zai honbi ga hi an ti thau nangin in Mizoram lung zai hon te chu ari sa sang ve ani chu chan chu aron kal te kha phai kal tura ri sang to te ve kha India wang khan phai kal ngam chat to lo te kha an ni ve ka wang khan in ba khan case har sa ve kin ni ta ni kha lung chat lo in lung ina thi sena pek chha to za thi atlang puin 55 atanga 45 atanga 55 tal ani tura ni ta ma se nang mani chu 25 te 30 35 lek te khainya kha wang khan ani tan po khan in zai kha har salu tuk ta ni chu chuanin chumi be pyala ma zum thum nei te kal thalo te khaino ni le je boga chanin kapu bi chu akeroti angonga ven athua ka thisen pechwa pechau tu khami tha alo block vele zel bok nen khan I India rama lung zena apo khanin a serious case unlock me do lo to chi te ve kom khom kha kanya kha wang khanin headline hona chatta ka zai hon thea chatta ka perform thea dam chade wa kanin mule ve khi alo mama nang manin rin na rin na in pe ngama wang khanin kan lom nu tuka in rin na zong ne ron kal wang khan kan loma chu tyang bok cha Mizoram ni puite tan thei to kan chwa zelang atin cha
This time you probably. With that, thank you so much for coming once again.
Association of Surgeons of Mizoram ina unorganized ania hemi CME kan tema Dr. Rohian akhat token in da hiam nei kan nei reng turang ai ni chumi yang chu tu kan wortel tra Mizoram ko hian chumi program anga chuanin hei tuna dar sari tangin kan program in tran vedon ni nang ni ho nei kan program chu khami ma khan kan lo ru chua kan ni
kini hi LB tluanga thingsul thlia khuate chung kha kan nia ani hi khumbeta la ma wangin a ai oin kan lo kala chet angin August ni som panga khanin kanan tloa maro chu kha khanin alo fel lo top maya biak thina lo om lo ngala hospital thingsul hospital kan kal chawa chuan doctor kan rona har reng lo maya ambulance in kan in phur thla thengem kan tia ti chuan kan in phur thla kalkonga kan kalain doctor lalri nahi ka bia amaro chu ani lo om lo wa engponi sela anai vai kan ti elare ma kan luta chuanin kanan tia solai elarem hospital khanin an doctor khanin engponi sela hei kan din mun hi helai kan ti theiba kan nia chuwangin phailama kalmai ro mintia ta chon doctor lalnin na bok chu hunrei tak tho in sia kan dia wangin chanchin kan jota helai kan zai ve therenga nisom ni pathum oga sa henin doctor lo thleng dona chuti chu kan hospital lo phei mai ro atia ti chon som ni le pathuma doctor lo thleng ta som ni le pathum zan ni tain ka thia kan zai kha ti chuanin kananin zai ta atira chuanin LRM hospital ya doctor ten mineng lo dana chuanin a brain lampanga zai block zai tura an ngaya thil dang alung lampang chu an han mulem lawa amaro ju heta Trinity an investigation an ti khanin alung lampang po oma chu wang apahnia zai chin hian ti ta mase a patient na tlin don lawan sheta wangin alung chau hi zai ni mai ro se andita alung an khoi tak nuwa chuanin a improve ta nuwa hianin zai ngai lo ta niin an theta chu kan din monan ya
o December thla khanin ama kal thelo wang khan check up shim ICU doctor ha kan va moa pi nen no ama BP te engkima that to wang khanin adam doi heta doctor Rahul aten tura an te angka an reduce ta dam doi ka chili che an cho to ta chu ala chung som ta tun thlengin ama chu achangka nga harpo har tha azan mulo chhun mu kan problem ber chu nya aba ka chuanin har sana kan nation to lo
medical science te heng thiam na ang chi hi chu nge ngai to na nei zau ve pol takhi kan nia chuwan chuan helai an zaingam chuanin an thiam pi na ni maya tin chu baka heng lung te brain surgery teng te chu a serious ema chuwan chuanin kan thian helaya mimal taka kan rin kan lo hriat chian in lalrin an engkim document le nge manruak kan nei veka Delhi po panula Delhi apo zuk zaiula ai nang renga tia wangin chu ringa pantop kha kan ne khatyang zonga chonin engma harsat na kan nei lo chuwan chonin tuna treatment apo chonin nge tunge Rahul nge Chandana vo ki Apollo le nge khoya nge khatyanga thok thok kan ne Delhi apo chu tianga zukal paila aniang bak zuk ron turan om chuang lo ti ka confidence lian tak nei nia kan omawang khanin kan pan top ani
Coming to David Lal Fakzuala Rautenia 2011 kanin Birla Kolkata angioplasty zo kan tito at mun nian ing kriata tronin stenting ka kan tia ka tho hi thip thina ka halek jon ka tho hi tla hi thip fakat jon kal thei to lo top thina kong chuka po khan ka kal lei thei to lawa thip lu tuk ta Trinity a hian kan vein entir ta chuan angiography kha kan timasat kan tian tipota aloin block full vek to ting ina om lo an tia surgery kha ngai ta LCBG som pathum April ro April a khan min zaita min zai lai vel ka chu ka chuang lo me se kan ze min zai lak lo lai khan ing kha nga ballooning te kha ti nga ya kha han ti le chop chuk tu ka complicate ang renga min zai dan kha
midang hau ai khanin a shim shimin an zai don khanin doctor khanin a zai tu patur khanin a case a har sabi ka tia mu a chene to a lung hi a chaklo lu tuk buka kha tia kha wang khanin midang zai to ho dang nen chuan compare lo turania I recovery pore bi kanga ti khania mu ama hi chuanin ti don ro chuanin phaila ma kalila ti kha kan han ti dewa tir kha chuan ma se kan ti lo kha kan in chhir lo zo ka chan chu ti khani pneumonia ti khan contract chaw ma hi tun ma in smoker ve na sat da chwap kha chaklo wa mu kha wa han pneumonia kha an ve chawle kha khanin a ti buai te lu tu khania chuan thi sen pek te lo ngai tam deu khati khanin chung te om huna kha chuan mani rama kha chuanin chung te leina nai te an ron kala o kan kal lo kha kan ti fuang reng zo ka
a thar ve na chu heta in zai chu satin check up te lo ngai ta khata khan aizol trangin sata Trinity kan kalme ya thoda ticket la ka khatia satin phaya kal ngai lo khan chen oma kalang me kha kan nya kha ka tha ka ti na ni aizol in zai chu equipment vela chu zong rong king thowa heta om vek thoboka as min zai tu phaya mi te thawan ni ta a difference ka rewak lo vai rama kali tu na bak ka relawa
chuanin pakhat kalau soi ve du shim chu Trinity Hospital hi kan fak top he enge mi bia kan nuam lu tukamo mang ang dewin kan omta kha din mun khan thalo chau khang lai te po khanin hey lifta duty te thleng khanin ingin an inge he biak she ominan om ngai lo ni chu lim sang hian min berenga va inentir va kalle te po hianan vai hianin an fel kan tia
ICU nurse thokho hi ka fak duwa nurse so ni lo an helper chong te komre ke ma kha ka conscious nu khanin kan harreng khan thil ei theisi lo khan komta caring a try member ka an ma ni ka an lim reng thaya mi thil te nom deu kham khoya ti khan lim deu khanin thil khan ei le ang bora
bia khi an nuam lu tu ka ICU nurse how page an buayan ya an thuman lo re เมลลิมเฮตรงกำยันมินเหล่าทำหวานนะเฮริงดปวกค่ะกี่มานี่ตันขจวนดำนะทำค่ะนี่ลุตุกะ
จงชอบมาฟันูกันเนี่ยอามาเฮเองเราจังลำปังเจดิ้งลำปังเจงให้อันเสียงฟังอินกเราจงสักโดนเอ็กซ์เซสสักโดนเนี่ยจงที่เองเราอาเฟียเราเดี๋ยวแค่ก็จงที่หาสัตว์เดียวบุกะกุมสังนี่ส่งภาษาริเวลอาจารย์ฮันเขามีคริสต์มาสนี่ฮันินอามาเฮนินให้อาลุงเวลอย่างไรนาคาติลุตุกะส่วนให้รอยกันเชนี่ค่ะนี่บอกเสียหนวมเราแต่ตุกค่ะเขามีค่ะกันนี่เองที่ไม่โดนนี่ดำด้วยนะคิดว่าแกจะเตียกันก็ไม่โดนมีกันเตียกันก็ค่ะอัลฮาร์ดเทคค่ะเราเนี่ยนี่สมมติส่วนเขามีหนูฮันกันนี่เอ็นทีระให้โคตัวค่ะกันนี่เอ็นทีระป่ะค่ะวะลอนเสียแต่ค่ะกันนี่เอ็นทีระนี่สมมติส่วนเขามีหนูอ่ะพวกเขามีหนูกลุ่มเดียพวกฮันนี่ฮาร์ดเทคค่ะนี่เดี๋ยวเท่านี้สมมติกลุ่มเองเลยว่าฮันกลุ่มตีระนิวยอร์กไรเชียนี่ฮันนี่นั่นเองเลยนี่ส่วนกันนี่เอ็นทีนะป่ะฮันอาลุงให้ดำโนอมตูดให้โนตูอมังค่ะขามีค่ะอมตีค่ะสวยนี่สมมติส่วนขามีค่ะมาเสอัมตูน่ะให้อมตำไม่มังค่ะจูอันนี้ตัวอันนี้แล้วนี่จูอันนี้แล้วนี่จูค่ะให้ดำโดยมังกรดำเทียงค่ะนี่ตานี่ดำโดยค่ะโจตาส่วนค่ะจัดเจอนี่จูอาปะเฮียนส่วนค่ะให้อาชาเวชาวเจลังอาหารกันง่ายนี่สมมติส่วนมาเสมาให้อินซูมเทเลวเดี๋ยวเนี่ยไม่จะเตะให้อาจุเร่งอาหารเนี่ยให้ด็อกเตอร์พวกเขานี่อายาวันเท่านี้จูจูให้จูตัวนี้อปยังอินเราเทค่ะเท่านี้จูมาเสมาให้อินซูมเทเลวตัวก็เตะพวกเลยอินเตอร์นังเร่งอาหารเขามีบางฮันจูมีนู่เวลฮันจูมาตุนกลุ่มอังเวงน่าเขาดูกันปันมาฮีอินทีร์อันน่าใครเชื่อมอาอุเทหันว่าอินทีร์อาชาอันทิมสุเชื่อมจนอินทีร์ตาจินเตียฮันินตัวน่าด็อกเตอร์พอฮีอันยังเล่านี่สมมติด็อกเตอร์ดังค่ะตัวด็อกเตอร์ค่ะอามาซาจุดยังเวลด็อกเตอร์โรฮิตาอามุนิจุมิจูขามีค่ะอันว่าอย่างเราจนขามีค่ะด็อกเตอร์เมลค่ะอันนี้เราท่านมันนี่ค่ะเลยตัวป่ะ
ที่ด็อกเตอร์จันโดลาเห็นที่อินปันดานเจ้าด็อกเตอร์จันโดลาเห็น
ก็เลยน้ำมันเขามาหวังกัน
บักไอ้ขามีค่ะอันเราโตอันนี้จูอะคาตามีอังฮันอันเรารีเฟอร์อังอาชาอังฮันอันเราที่นี่จูจนค่ะอันนี้อันเราคัลโดนบ็อกซ์ใจตูข้ารุนคัลโดนตาเหตุมาคันินอันเราคัลโดนมาคันินหุ่นดังกันเองเราโดนมีค่ะอันที่สมมติหุ่นคุณรำดังคันินกันกัลโดนเงี้ยเหตุกันใจที่โดนจกค่ะกันเชื่อแล้วนี่จู่ด็อกเตอร์เด็กค่ะคู่ด็อกชิลองอามีคู่แต่เวลาพวกค่ะนี่ด็อกเตอร์เด็กค่ะอาเชียนเตจุมีเมียเช็ดตาจงค่ะนัมเบอร์เด็กค่ะกันอันนุปุยเวลค่ะกันดีเลยนี่จู่มั้งจนกันสุโกละอามาเฮมีเฮลายาresult เวลค่ะลุงเองระวังจีมันนี้คือมีขามีเด็กค่ะมีรอนทอนอุลากันเราเอ็นสินังคันดินจุ่มจนอโคค่ะอันมานี่จวนอโคค่ะชาลวันเราตีนี่จุ่มจุบค่ะเหตุการณ์นินอาใจเทียคุตาจุกกัลไอค่ะจวนจุกกัลค่ะจุสุ่มเด็กค่ะอะตอมเวอะตอมเวจเท่านี้จุมาเสเหตุการณ์จวนนินกันตั้มตากันเจนนัดนิตากันมานี่ตัวพวกขานินกันว่าปุยเทโดนังจกขานินบางขานินอาชาบักอาชาที่อันรีเฟอร์เวชินะบางให้ตายอันเก่าชินะบางขานินกันดูแต่จกขานินจุ่มเกี่ยนี่จู่เกี่ยมันเนี่ยจวนนินกันอาชากันที่ตัวมันนี่จุ่มหันใจเท่าถึงพวกเสียให้อา
amal ang turang ngal kha chu ni lo ma se shem I apa phe chu I a har te khanin akal thei ngal ang vel ang tho deuh tho khanin chu shem I ma se a stroke kha hei hemi dinglam pang tha zong kha a jeng trep ang kha ni wang hanin I alei te zong zong te kha shem a mang tha thei da lo ni chu cho te pu kha I atira kha chuanin cho te ha kan tin nem hei nem de chu nem hi ai tha thei ai du vak ngai lo ni chu ma se cho te ha kan eng lo ta ai kan rot sak ta tu na chuanin hei chu tiang an lo te cho ang em to na te pon kan peta ni chu mo
Kaming chu e melody hania kapasal hi kelal machwana ania sang ni samni pani July ni atang khan kan pa hi jing dar zat che kan shelawa mai ro chu ni khothalabin kan ruma hian alo tlureng maya kan han mu chuan kan han soi nok noka amai ro chu a har lok lova a BP te a sugar te kan han cheka amai ro chu engma thatlo na nei in kan shelawa amai ro chu khatianga ni khothelawa lo om taringot chu ti in Aizol Hospital kan kalta Aizol Hospital kan kal khan ECG ten han ti khan heart attack ani anti chuwan chuan ICU kan lu ta ngal ruma ICU chuan zan thum kan oma ICU zan thum kan om nu chuan wata nisari kan om le ti chuan tha te in kan chhuaka amai ro chu phailamatangin Trinity Hospital hian phailamatanga heart cardiologist specialist and local thin te kan sia ta wangin kan vein entir ta July thatop lama kan vein entira ti chuanin Dr. Rohit Tiwari kan mua ani chuan min lo ena ECG te echo te min ti echo kan han ti khanin angiography ti turin min cho kar khat nuwa chuan angiography kan ti ta angiography an han ti khan blockage mutnim te meya ti chuan zai ngai ni hi hetianga anasat mawang hian zai nge ngai ni hi ti in min rona ti chuan August ni som pakhata zai turin kan luta August ni som pahnia chuan min zai ta amai ro chu complication ana sa meya an zai chungin a heartbeat se po voili lai kha atopa amai ro chu thate in a lo chwa ka ICU wa zan som kan oma zan som kan om nuwa chuan kan chuak ve theita lom khopin kan sia hetianga ti man local hi ke ni tan chuan alom me phai pan ngai lawan local theiringot po hi kan loma atira po khan heta zain du man han tia du kan tia chan chu chung khat leina naite min thamwan tura helayan local ringot te po kha ke ni chuan kan thalela phai te po kalila sen so tam taka dona amai ro chu helaya nas lungmuang taka zai thei ani kha kaini tan chuan a thlak hlel kan tia thi sen te po unit som pariat pe ka ngai an tia wangin chung khat leina nai kan hanin ron khoma kan hanin ko khoma YMA te ko shan te kan thenrol tha ten phal takin min han pe ringot te po kha helai Mizorama min zai thei ringot po kha kaini chu kan lomani ti chuan tha takin an zaya hei adam thae memin kan sia kan loma doctor le nurse te a team ho zong zogin min enkol thae meya chuwan chuan lom thu te po hi kan soitel do ni chu lom
chuan kan soi lok du chu hei Trinity ti hian lunglam doctor specialist an local ringa hei hi lung that lo na nei te tam tak an la zel don poi la langa chuwang chuanin phailama kal theite an kalani poila thathawe ama ro chu Mizoram nge ya hetianga an local hi alom oma chuwang chuanin a thei chuanin har sanna dang em omani ro chuan lo pan ve taula a tha khopin karinga hei hi kan tan Mizoram tan thil lom le thil hlut takani ti kha kan soinon ve le du mai ani
วันละลมากันนี้ลงเลยบาซาร์เวงกันนี่กุมสังนิสมนิปนิออกัสนิสมปนิคานลุงมินใจสัก Trinity Hospital อาฮิอันที่ชวนมินใจอัตังอินมินใจมินนอร์ชัวอัตังอันนู้เละเชงเละตุนเชงปอยฮันฮาร์สัตนันเนยลวินก็อมาปะเทียนของไอไลน์ดำทัดตะกินก็อมเจละจุงจุกันสวยดูตินอันนู้เละปอยฮันลุงเลยอมกันเนียพายปันง่ายลวะไอโซลาหันอินเช็คอัพเตละดำโดยจูลเตหันติเตตินเกมาฮาร์สัตนัจุงจางเตเทเลโฟนโมบายโฟนมังปอยน์อัฐกตัวด็อกเตอร์เตปอกันโรนาอันนินเฟลตะกินตะกินมินไงสักฮาร์สัตนาเองโมเดลดำโดยไอจุงจางเตละทิลดังเลียมหันในปัลทัวเตปอดำโดยชากง่ายมเจนสง่ายมหันติเตปอยน์ทัดตะกินมินรอนไงเวนทัวทัวเจละทินก็สวยงคานอินเช็คอัพตูระมุนลากัลง่ายลวะไอโซละกันกัลไม่เฮอลสัมทากะลุงหันใจจุทิลริลเลรับทักตักอันนี้รัวเลนมินใจสักตูเทียนอันเนสอเวียวนีอินกระเรียที่เฮียนตัวน่ะเฮียนฮาร์สันน่ะในลวินกับอมาพายเตะคานมินโลกัลตานิตายละอินเช็คอัพตัวรักกัลเลปอหาวตักินซุมเลไปเตะคุลายะอัดเห็นนัตูร์เตะขัดยังปอหันซุมตั้มตักเซนนัตูระไอโซลเตจูมิโซรัมขบุยอันนี้บอกจุดยังหาวตักข้าอมลวินเตียงเฮียนกันอมเทียเฮงเตหิอัศนานีตินอันมานี่ฮิมินใจตูเตหิเดลีลำด็อกเตอร์เทียมเตอันนี้มินใจดูตกไม่โลเฮียนที่เฮียนอาคาตกินกันจันจินเตมินโซตมินไงเวนเร่งและอันโลกัลเร่งฮีพายะกัลเนี่ยดังลำน่าอมจงอินกระเทลวะอาชากติเวียวอันนี้